I received a lot of messages after my last podcast, Day in the Clinic, asking for more. So today, tune in as I share about another day in the clinic with 5 different clients, including their symptoms, findings, and the treatments I provided them.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hey, everybody. I am excited to share with you in this episode another day in the clinic with Lynn. I had a really good day today, and I just wanted to share some of the things that came up with my clients and just help you to get a better understanding of my clinical reasoning and what I found and what I did. So, my first client today is actually a midwife. I had 2 midwives today. And she has a lot going on in her body and has been complaining of chronic bladder infections and pain. And when she was 4 years old, she had she reimplanted, or she had a surgery that reimplanted the ureter into her bladder bilaterally. But there was a ton of scar tissue on the right side, and she's been dealing with UTIs and all kinds of issues. And today she came in saying that her vagina was burning and it was burning up into the urethra and the bladder. And she has this feeling that almost feels like nerve pain around the bladder and the urethra, but um, she's just dealing with this chronic issue in her pelvic space. And I sent her to one of my acupuncturist that I work with who does sound healing. And she talked to her and was talking about the depleted energy in her body and her hormones, and that her heart energy was really low. And when I went to do where my hands wanted to end on her body, it was at the womb and the heart. And so I started with the 3 energy centers and balancing those 3 energy centers that I teach in the Birth Healing Intensive program. And then I was drawn to her left round ligament because as I had my hand on the uterus, I could feel my hand that her left side pubic bone tissue it was more swollen than the right side. And when I went to palpate the round ligament, the left side was definitely a rope, and I could barely find the right side. So when you can feel a ropiness of the round ligament, it's in dysfunction. And so I released the round ligament, did the mobilization of the uterus on the bladder to just make sure that was nice and free. And then we went internally, and what I found was her cervix was way off to the right hand side and stuck posteriorly. And there was some restriction to her bladder fascia, anterior wall of the vagina. So I worked on that a little bit. And she was telling me that she has fibroids in her uterus. And so I was trying to figure out, was the fibroids what were, keeping that uterus off to the side? And we just got curious. I just asked her to get curious with the fibroids to see what what she felt going on in the uterus with the fibroids. And she was like, "Oh, that's where all my anger is inside. It's kind of walled up into those fibroids." And I was like, "Okay, great. So can we honor it? Can we let it know that we know it's there and thank it for containing itself so beautifully in your pelvis for you?" And then, let's just see what happens. And as she did that, things just kind of melted. And as she was able to release the anger, I asked if she could allow the energy from her heart to come down into her pelvis and fill her pelvic space with love again. And we also tuned into her ovaries, her left ovary. So when I first tuned into her uterus or her pelvic space, I found that there was a massive imbalance in the energy. Left side was empty and right side felt heavy and restricted. And so whenever I feel an imbalance in the pelvic space, I'd like to go work with the ovaries and see what's happening in the ovaries. Well, her left side was a raisin, her right side was a balloon. They're supposed to be plump, juicy grapes. So we worked on balancing out the energy there. And then we worked on the anger and releasing the fibroids and everything. And she was able to bring more love into the pelvic space, and her pelvis felt amazing afterwards. And it was more nice, more balanced, and the energy was flowing, and she just felt really great after that. So that was really, really cool. Um, So my next client today was 37 weeks pregnant with number two. She has a 3-year-old, and she was getting some Braxton Hicks contractions, and also feels when she gets up, she's laying on her sides to sleep, and when she gets up out of bed, that she feels like her pelvis is unstable. Her hips feel unstable, so she just kind of has to stand up and settle in, and then she's able to walk. She's having a hard time sleeping with reflux and everything. She's going to birth in with the midwives at the hospital. And when I evaluated her, she had zero flow going down the right leg. She had some flow going down the left leg and standing. And then when I had her lay down on the table and I revealed her, I lifted up her shirt to see the linea negra. And the bottom line, so from the pubic bone up to the umbilical, there is like this pull to the right, and then the top of that line as it entered into the umbilicus went off to the left. And then the top line was straight until it came to the umbilicus and it went off to the right. And so the lines were showing me that there was right-sided, lower right abdominal fascia tension, and then also left posterior rib cage tension. So I did some release work in those areas, and the right lower area was really, really restricted. Her uterine ligaments weren't that bad though. It was more the abdominal fascia that needed to engage more. And interestingly enough, when I went to palpate the baby's head, I really couldn't feel the baby's head. She's 37 weeks along. That baby's head should be in the pelvis, but it felt like it was riding high and not very engaged. And she did report that occasionally she could feel it engage into the pelvis and then it would pop back up. And so my whole intent and work was to like, let's release that right side. What needs to happen for baby's head to engage more fully into the pelvic space? And we did release the bilateral round ligaments. The broad ligament was fine. The uterosacral ligament on the right was tight, so we released that. And then we did an inversion. We also did intravaginal work, and internally, her right side pelvic floor muscles were really tight and tender. And the baby was still really high in the pelvis. I didn't encounter the head at all. When we got done releasing the pelvic floor muscles, I had her do an inversion and come back up, and the baby's head did descend down more into the pelvis. So she's going to work on doing some pelvic tucks and standing, so posterior pelvic tilts, lifting baby's head to help encourage it into the pelvis more. But interestingly enough, when we went to do pushing, whenever she pushed, she just tightened right up. And her best relaxation was just her relaxing, not pushing. That's when I could feel good lengthening. And we worked in all different positions. Tall kneeling was easiest for her to be able to lengthen and let the pelvic floor muscles go. And so I was encouraging her during the labor to just let go, get out of the way, let the uterus push that baby on out, and you just work on lengthening your muscles. So that was a really fun one to work with a pregnant client tonight. And then I had a repeat client of mine who's a massage therapist, and she just got a total knee replacement done mid-February, I think. So she's 3 or 4 months out from the surgery, and she was complaining of a lot of shoulder and neck issues, which was opposite of the knee. And I totally felt a connection from the knee to the shoulder. And she had just had some shots done at PRP shots, I think, or something, prolotherapy. I'm not sure exactly which she had done, but I worked a lot on her T1, 2, 3, and lower cervical area, getting more mobility in there. A lot of tension in a cervical sternoclavicular joint on that left side, and just I really had my hand on the shoulder and my hand on her right knee, and just really kind of helped the unwinding between the two. And then after I got done with all that, oh, and she also had a lot of cranial tension on that left side. So we did some craniosacral therapy releases in her cranium, and then worked on her knee. And it was just interesting that she kept talking about these bands of tightness that is keeping her flex. She's stuck at 120 degrees flexion, and she'd really like to get to 130. And what I found was really the insertions to the hamstrings where it was really all restricted in there. And so I just dug in and just worked on releasing that soft tissue of that hamstring attachment into the posterior knee. And that really softened. And then she was able to bend her knee so much better. So I truly believe total knees, total hips, all that, they need that soft tissue work and that manual therapy to really help the assessment or help the recovery of those range of motion of things, not the hips, mainly the knees, ankles, those kind of joints. Then I saw my other next client was a beautiful young gal who is in relationship and would love to have intercourse, but it's just too painful. She has a lot of pain right at the introitus. And this was such an interesting case because this is my second time seeing her. And she came in talking about the exploration that she started to do of really exploring her exploring her pelvic tissue herself. And there's just a lot of pain right at the opening that when she keeps it there, it relaxes and lets go. So, oh, I'm sorry, this is my third time seeing her. And I did in my note last time, I did the release worked with the uterus, the uterosacral ligament, cardinal ligament was tight, and at the external anal sphincter was very tight, and it said it did not want to talk today. So I said, need to address this next time. So as I worked with her today, her left externally, her left coccygeus muscle was super tight and it felt like that tailbone was just being pulled off to that left-hand side. So I did a lot of mobilization between sacrum and tailbone and releasing the uterus or the coccygeus muscle. And then internally, she definitely had a lot of pain at the introitus. But I found her cervix. I was able to, go in very slowly and get beyond the pain. So superficially, like in the upper half, there's no pain. It's just down in that lower half right at the introitus where that pain and that tissue is just so sensitive. Whenever there's sensitivity in the tissue, whether bladder's burning, rectum burning, or any sensitive of those tissues, I want to get to uterosacral ligament and see if I can release that so that we get the nerve, the inferior hypogastric plexus released so that it can hopefully deactivate some of that sensitivity to those tissues. And I did do that. I found her cervix way up on the right and superior, so almost poking into her bladder a little bit. And I helped get the cervix back into midline, release that, tonified the uterosacral ligaments, and and then the uterus or the cervix was way more midline and everything. The cervix was way more happy, but um, she still had tenderness at the opening. So then I released bilateral coccygeus muscles because there was still some tension that on that left side more so than right, but I did release both sides. And then I was drawn to the external anal sphincter muscle. And that, as I just tuned into that muscle, I could feel the posterior half of it just being pulled and pulled backwards. So I put my external hand on the tailbone and I just encouraged that more, and then it released and it came up, and that tension on the sphincter released, and she had way less pain at the opening of her introitus. It was amazing. The tissues were softer And so for her, it was really the releasing of the sphincter muscle that helped that tenderness. So I'm super excited to check back in with her next time to see if that stayed and if that is much better. And then my last client for the day was another midwife who is coming to see me postpartum. She has a 9-year-old and a 2.5-year-old or 7-year-old. Let me see. She has her 2.5-year-old is her youngest. She has a 7-year-old and a 2.5-year-old. And she's concerned she has erectocele and then also worried about her pooch, her belly. She has been working with another PT for several sessions, but she said it's way more education. She was like, she wanted more than that. She did see a Euro guy who saw her for 5 minutes and said, yeah, you have a little bit of erectocele, go continue PT. She was really pissed about that. She's had 2 vaginal births. She did have a second-degree tear in her second one. She was left side lying for the second baby. And the first one, she was supine, kind of pulling on doing a tug of war with a rope to birth the first one. She said pushing was awful for both of them. Like she just couldn't get them out. And she does, her rectum is her biggest complaint. Her bladder's fine, intercourse is fine, but she sometimes has days where she feels like she just has to poop all day long. And there's that feeling that she has to. She does splint a little bit to help get the stool out, but it just feels like there's incomplete emptying. And if her bowel movement is really hard, then that's more painful. She does do her best to try to keep the bowels soft, and but she's like, I'm just tired of it. I don't want to have to be so particular with my diet. I want this to be easier. And so what I did was I did my assessment in standing. Her right side had zero energy flow down the right leg. When I had her in supine and I did the leg lifting and I rotated her legs, the right leg was a lot stiffer with internal external rotation than the left. The left was just like no problem. The right definitely had some resistance there. And in my head, I'm going, she was left side lying when she birthed her last baby. I wonder if I'm going to find that right ischium more splayed out. Well, I definitely found increased resistance to internal external rotation of the hip joint. I wonder if that's coming from the ischial splay, and it was. So I did find her right PSIS was harder and more prominent than the left. The left felt like it was like tucked in, and the right was at this weird angle and it was harder, and there's less mobility on that right ischial tuberosity. Left was great, and the angle was greater on that right side. So I worked on bringing that in, did the close the bones exercise, showed her how to do that. And then I did a side-lying release with the ischium ilium for in-flare, out-flare, because I felt like that was going on with her as well. And then after I got that, I felt like the pelvis was in much better alignment. I rechecked her hip and it was totally fine. No increased resistance to rotation. She also had some sacral flexion going on. So I worked on sacral flexion, and so then oh, she also had right side uterine mobility issue, a restriction, so it wouldn't move to the left as easily. So broad ligament, uterosacral ligament were definitely restricted on her. And so we released that. She had a tiny little bit of slight separation of a DR right above her umbilicus. So I taught her, and she did have restriction on her left side of her rectal fascia. So we released that. And then I went internally, and she definitely had increased tone in her pelvic floor muscles on the right side compared to the left. And then I did find bilateral coccygeus tension. So I was like, oh, the sacral flexion isn't completely healed or completely released. So I did a little bit more of that while I was internally. And then her tissues internally, she's had weird responses. Like she was kind of like cringing a bit as I was touching different tissues. And I'm like, is this creating pain? She's like, no, it just feels weird. Just feels weird. Like any posterior, like I was on the at 7 8 o'clock and 4 or 5 o'clock, but any pressure posteriorly felt like it was like she had to poop, even though I'm on muscle and not rectum. And then working on the anterior vaginal wall tissues, um, they were sensitive. And I found her cervix off to the right again. It was a right cervix day today. And it was restricted and it felt a little low. So I released bilateral uterosacral ligaments, cardinal ligament on the right. And I also, it just, the tissues were acting, her reaction to the palpation of the tissues was just funny. It wasn't normal, and so then I tuned into the cervix, and I was like, "You know what? This cervix tissue feels hard." Like, the cervix itself wasn't that soft, pliable tissue that you feel for most cervixes. It was really hard, and so I'm like, "You know what? Let's just breathe down into the cervix, and let's send it some love. Let's ask it to release any shock or trauma that it might be holding in these tissues." And as we did that, it definitely softened. And then as that release happened, she told me that she was thinking about a miscarriage that she had, and she had to go to the ER because she was bleeding, and the doctor was going in and scraping things out, and it was just really not done well. And she was like releasing that, and that's what helped soften the cervix. And once the cervix tissue softened, the palpation went to normal now. Like, none of the tissues were weird or tender or felt off. And so, boy, when things aren't when people aren't reacting well to your palpation, there's something going on in there, and think either trauma or restriction to the uterosacral ligament or my other client, the sphincter. There's a reason why, and we just got to keep being curious with the tissues to see what is showing up. So, uh, her also, after everything was less tender, then I checked out her external anal sphincter, and the inferior posterior half was tight with lots of knots. I released one spot and the whole thing released. It was connected to that sacrum being in flexion. So bringing those tissues together helped it to really release. She definitely had some left side sphincter fascia tension. So right on the outside of that sphincter on the left-hand side, it was way tighter than on the right side. So think of like the IRF, but more superficially. So I worked on releasing that. And then I found her left perennial, transverse perennial muscle was really had a lot of tension in it. So I used the ischial bone to help release that. And that really softened. And she just had a slight little bulge right at the perennial body. I checked her in standing, and she has great pelvic floor muscle contraction. As we kept doing all those releases, that just kept getting stronger and stronger. And she blew up a balloon. Nothing really bulged down and out. So I'm not quite sure. I can say that she definitely. I can't say that she definitely has a rectocele or not. Like, I would need to assess her with stool in there to see what actually happened. So I told her to go see how it goes and try to keep her stool as not as rocky or hard as possible, keep it soft and smooth as possible, and see how it goes. She definitely had weakness in her lower transverse abdominis muscle, so I instructed her in some pulses, end range pulses, and she was like, "Whoa, that is so hard. That is so weak." And talked to her about automation and making sure that things are coming together. And when she walked out of my office, she was like, "Oh my gosh, my left hip feels so free. It feels so much lighter. And yeah, this is crazy. This feels so different." So I'm super excited to hear from her to see what's happening if she does have an actual rectocele or not. I wasn't able to determine that today, and I think time will tell. So that were all of my clients today. I did have someone cancel, so I only had 5 and not 6 today, which is my normal number. And so yeah, those I thought those were all really good. There were some common themes in there. And I do find that right side cervical positioning of the cervix. Cervix was off to the right today was the theme for most people. But it was so interesting that when you release certain tissue, the sensitivity of the tissue releases and lets go. And that is so fun, so great to know for your clients. So keep being curious with the tissues, get to the bottom line of why they're doing what they're doing, why they're feeling what they're feeling, and make those effective changes. So if you want to learn more about everything that I just talked about, that's what I teach in my holistic treatment of the postpartum body course, and would love to have you join in, whether online or live and in person. We would love to have you join us. So take a look at the website, check out my courses, and let's get this information into your hands so that you can be just as effective with your clients. All right. Thanks everybody for listening in. Have a fabulous day. And here is to smoother births and faster recoveries. See you all in the next episode. Bye bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.